In this video, I want to talk to you about the ACL, or what stands for the anterior cruciate ligament. What is it? Why is it so tricky to rehab and so frustrating when we injure it? And one of the big questions that I get asked in my everyday life is, will Virgil van Dijk be playing football this season? Don't forget, if you like some of our content and you enjoy some of these tips, this information and help you with your fitness, health and well-being, make sure you subscribe and you hit that bell notification, because then we'll be able to update you on any time we're bringing out new content. So, the cruciate ligament. Well, first of all, what are the cruciate ligaments? Well, the cruciate ligaments are two ligaments that sit at the back of our knee. And we have the anterior cruciate ligament, which means in front, and we have the posterior cruciate ligament, which means the back. And you may have heard this term, the ACL. Unfortunately, in my opinion, it probably doesn't get more frustrating or more problematic than injuring your cruciate ligament. So, why is this so problematic? Well, firstly, let's explain how we injure the cruciate ligaments. So the cruciate ligaments have a big part to play in rotation. You can see these cruciate ligaments at the back really become active here as I start to rotate this top leg bone on top of the bottom leg bone. So unfortunately, this is how we commonly injure it. It tends to be when our foot is planted or our lower leg is fixed and we rotate the top. And then that's when we can damage the ACL. But why does this ACL take so long? And it typically takes around 9 to 12 months in order to fully rehab it. So the reason it takes that is because we don't have a good blood supply to that area, so it doesn't naturally heal itself. And as a result, if we do rupture that cruciate ligament, it very commonly requires a surgical intervention in order to fully heal it, because it won't heal naturally on itself. And the thing is with these cruciate ligaments is they sit outside of the joint, and as a result, there isn't this natural blood supply, and they take a long time to naturally heal, because once the surgery takes place, we need to allow nature to make the graft take. And that, as I say, we want to take 9 to 12 months for this to heal. So, in order to answer the question that I get asked commonly, will Virgil van Dijk be playing football again this season? For me, the answer is no. We won't be seeing Virgil van Dijk until next season, because it will take the 9 to 12 months in order, no matter how much rehab work done, no matter how much specialist care he has, he will not be able to play and beat nature. And it's very frustrating for me to say. I'm a huge Liverpool fan and a huge Virgil van Dijk fan, and boy do we need him. But in my opinion, Liverpool will not be risking the chance of reoccurrence. And that's the big thing. That's what can happen. And the longer we leave it, the more we reduce the chances of reoccurrence. So we have landmarks that we look to follow along the rehabilitation journey, but we wouldn't want a footballer returning until 9 months. But even at 9 months post-injury, we do run a risk of re-injury. So typically with an ACL, we'd be looking at a year to come back to full fitness. Now, there's very important things that we will be working at each week, at each month of the stage of the rehabilitation process, but ultimately that is why the anterior cruciate ligaments are frustrating to heal. So, in order to answer the question, will Virgil van Dijk be playing football again this season? My answer to that is no. I think we'll be seeing him next season. But what he will be doing is making his way through the vital steps in recovery. And in recovery, if you are somebody who's suffered an ACL injury, there's various things that you need to make sure that you're doing. We want to make sure fully that we are restoring a full range of movement. And that's the first thing we look to do nice and quickly. The second thing we want to be doing is building the strength that we have around the knee. So the muscles that cross the knee, so in particular the quads, the hamstrings, the calves, and then the glutes control a lot of those things as well. We need to make sure that we restore full strength in those and that we're protecting the knee as much as possible. And then the other key thing that we want to be thinking about with any ligament injury, but of course in something as vital as the cruciate ligaments, is stability. Ligaments control our balance, so we want to be making sure that the stability and the stabilization of the knee is good and is exactly how it was and exactly the same as the uninjured side before returning to sport. So that's the cruciate ligaments, these ligaments that live on the back of the knee, and they are a very frustrating injury to rehab and to heal. no matter how good the level of care is, we really find it difficult to speed up this process. So take the time you need, and as ever, if there are any questions that you have around cruciate ligaments or any injuries, feel free to drop a comment on below. I'd love to know if you suffered a cruciate ligament injury. How long did it take you to get back to pre-injury sporting levels? Let me know in the comments, and let me know if there's anything that you did in order to accelerate that, because we're always looking to find out that information, and I'd love to hear from you.